everybody. This is Liz Stevie, the CEO here at Rumeila Hospital, and I am thrilled to be part of this campaign to help remind everybody about the importance of washing these. We know that we practice medicine here at Rumeila based on what is best evidence. And the best evidence, the best thing we can do to prevent our patients from getting infected is to learn how to wash our hands and do it consistently. We use these every time we see a patient, and so doing proper hand washing, as we've learned, is the thing we can do. We owe it to our patients to care for them in the best, safest way possible. So please, every time you walk past a hand wash basin, a sink, some hand gel, use it. It protects our patients. Thank you. Masalama.
Okay, good morning everybody. I am Dr. Faraj. I am consultant infectious disease and chairman of infection control committee in Rumeila Hospital. This is a good moment to talk about the hand hygiene. The hand hygiene is considered now as one of the most important way to prevent or minimize the healthcare associated infection. And as we know, the healthcare associated infection like surgical site infection, central line associated bloodstream infection, catheter associated urinary tract infection, and ventilator associated pneumonia. The major part in the bundles of prevention of such infection is the proper hand hygiene of the healthcare workers.
السلام عليكم ورحمة الله وبركاته. كما تعلمون جميعا فإنه من قواعد ديننا الإسلامي أنه لا ضرر ولا ضرار، وهذا يدعونا جميعا إلى أن لا نسبب أي أذى لمرضانا. وبالتالي لو اتبعنا قاعدة غسل اليدين كلما دخلنا إلى المريض أو خرجنا من غرفة المريض أو كلما لجأنا إلى أو احتجنا إلى إجراء أي عملية أو أي تدخل مع المريض، فإن ذلك فعلا سيقطع سلسلة انتقال المرض والجراثيم من مريض إلى آخر. فرجاء الالتزام بكل قواعد منع العدوى، واللي أهم إجراء فيها هو غسل اليدين. Dear colleagues, as you all know that one of our focus and one of our mission and goals is to cause no harm to patients. Out of the many infection control and prevention practices, hand hygiene is the backbone of breaking the chain of transmission of infection. Please stick to the rules that we are providing to you: how to wash your hands, what's the technique, when to wash your hands, because this is the great benefit that you can provide to your patients. I trust you, and together we can build a safe environment for our patients. Thank you very much, and assalamu alaikum.
Hello, as the nurse leader for the hospital, I'd like to encourage all nurses and other members of staff in the hospital to take hand washing seriously. It is the most fundamental skill that anybody can have in the hospital. And if we get that right, then patient care improves. Thank you for your cooperation.
Hand hygiene is very important in the health setting. As we know, we all are the healthcare workers. We have to prevent infection in the unit and infection in our work area. So what I believe that all the healthcare workers, we have to follow strictly the hand hygiene practices.
الصحة الجيدة تبدأ بغسل الأيدي.
I believe that hand hygiene saves lives. It will protect us, healthcare workers, the patients and the visitors.
Good morning. All over the world, infection is a problem, healthcare associated infections. And we can tackle this infection by various methods. We can try to find out new broad spectrum antibiotics. We can try to find out new instruments. But the simplest thing is to do proper hand hygiene. And with proper hand hygiene, it is evidence-based, it is clear that we can prevent infections, we can save more lives. So do hand hygiene always in all contacts.
Clean hands deserve 2 thumbs up. Hand hygiene is the best way to prevent healthcare-associated infection in the hospital.
Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, everyone. Due to infection control awareness, always remember the infection, the goal of hand hygiene, that to prevent infection, okay, to patients and healthcare providers, following the simplest way, it's the hand hygiene.
So the proper hand hygiene is recommended now by WHO, the golden 5 moments: before touching the patients, before doing antiseptic procedure, before wearing a glove, after touching the patient, and after exposure to blood and body fluid or the patient's environments. So to deliver a safe care to the patient, please stick to the proper hand hygiene. Thank you very much.